My Republican friends want to sell our nation on the idea that we can have much more affordable health care if we have high deductible health insurance plans associated with health savings accounts. They tell us that if the consumer makes the choice, the consumer knows more about the price of medicine, and the procedures, they know what they're getting into, they'll make wiser economic choices for themselves. I'm a family physician, and I think that argument is full of bunk. What happens, and happened in our practice last year, is that the person decides not to spend the money, but you get a bad outcome. This is the story. We had a gentleman come into our practice last August, and he saw one of my partners. He said, "You know, Doc, I'm having this chest heaviness with walking up 2 flights of stairs. And I get a little bit short of breath with that and a little bit lightheaded, maybe even a little sweaty. What do you think?" Well, my partner appropriately said, "You know, John, you really need a stress test. We need to check this out." And he said, "Well, you know, I have one of these high deductible health plans. I don't think I can afford that, or I don't really want to afford that. How much do you think a stress test will cost?" "Well, John, it's probably going to cost you, a thallium stress test is probably going to cost about $2,000, $3,000. "Geez, Doc, my deductible is $2,000 and I really can't afford that right now." The way I found out about this story was I saw this gentleman his name looked familiar, and a week later I read his name with my morning coffee in the obituaries of our home newspaper. So this gentleman made a decision based on money. He couldn't afford the stress test, so he took his chances. Well, he made the wrong decision, and he doesn't get a second chance. To add to that, we recommend colonoscopy. Right now, the health insurance industry doesn't cover colonoscopy. So this is going to come up again and again, that procedures that we think the studies provide significant health benefit but are very expensive are procedures that people with high deductible health plans will say, "Hey, yeah, I don't think I really need that." Well, so we're not spending those healthcare dollars, but that's not in the patient's best health interest. This is not a true argument. It's just blurring the truth.